Of course, the latest theme in global health is universal health coverage. I think that is sort of on its way to replace the Millennium Development Goals and health for all by the year 2000. Who remembers that? Which then became health for some for 3 diseases. So I'm very glad to see that universality and principle of solidarity being brought back. The next speaker, and I'm very pleased to introduce to you Joanne Liu, who is the international president of Médecins Sans Frontières. She has not been very long the international president, but has been with MSF for a very, very long time. MSF, of course, has been the engine and one of the very important reasons for the very existence of the DNDi, not only because of the direct support of the establishment of the initiative, but also by drawing attention of the world to the fact that something had gone terribly wrong and how we develop our medicines, how medicines research is prioritized or not in the case of neglected diseases, and how it is brought or not to the people. So Joanne, in 2002, MSF published The Fatal Imbalance that clearly laid out how fatal the imbalance was. Now, a bit more than 10 years later, we're making up the balance again, and here again, I think we can divide the world in is the glass half full or is the glass half empty? It would be good if you could talk to us a little bit from your perspective, also from your experience. You have extensive field experience. Do you think that the fatal imbalance begins to balance the right way, or do you think there's still a lot to do? Joanne.
Thank you very much. I guess I'm going to do that in English. I'm French Canadian, but apparently it's really hard to translate me in English, so I'll do it in English. All right? Bear with me.
Go for it.
It's true. So I think it is great to be here tonight and then to celebrate with DNDi, what have been happening over the last 10 years. And what have been accomplished by the fact that DNDi have demonstrated that you can develop new treatment and more precisely more therapeutic indication for treatment, pertinent and at low cost. And that's something that is a remarkable achievement. And we are glad to see that it was not it was possible from I would say an idea of some few people and not the monopoly of only the big pharmaceutical like in the past. So what happened is MSF back then in 2002 we've seen what was happening. And then we knew that something needed to be changed. And I remember very well hearing some of the very famous words from Bernard saying, "But our patient die." And I think we all remember that, and that was a starting point as MSF. And that was our driving to do and move forward. And what we did is we put our patient, the needs of our patient in the center to drive that research and development and to fill in the gap that were identified. So I think that right now there's a real momentum. DNDi has created this new momentum, but not only DNDi, but I guess, in MSF, the Access Drug Campaign has, addressed as well some policy issue. So that is something that needs to be pushed forward, and we should not let it fall off. We know that new gains are around the corner, and we have to keep our commitments towards the neglected disease. But when I look forward and look at the evolution of the more global medical priorities, we can see, and everybody acknowledge it, that transmittable disease is an issue, but non-transmittable disease is the new issue. And in short, when we look at it, we're all going all of us die of the same illnesses. So cardiovascular disease, cancers, so we have to address that, and we have to somehow develop treatment that is adapted to low and middle income countries, where right now those treatments are totally deficient. And of course, being someone from the field, I just returned from Syria, and I was still appalled to see my patient coming with a bag of medicine. They put it on my desk, and then there's 12 boxes of medicine. Half of them are expired. And actually, my patient doesn't know why he's taking it. Most of them are is to treat his hypertension, in his diabetes. And then I know that it's in the pipe and it's coming, but I'm just being so anxious to see the poly pills to come up and be accessible to our patient in the field. So looking back again, in what happened, it's not only one single drug that I think will make the difference. I think it's great that we create new drugs and we got more, I would say, accessible and cheap drug. But I think it's the combination of what I call a kit of case management. And that's what that happened a little bit, with malaria, where we had the rapid diagnostic test, but we had ACT. And that's what allowed us to scale up our treatment and reach the population who were sick. So, so this is what I think we should look forward for the future. But it is clear that not only one institution can do that and then can create, this what I call this vital case management kit for neglected disease. So we're going to need to address that, at a higher level. And I think that strong commitment from state needs to happen, and of the international community. Sustainable financing for research for neglected disease and patient. We need some global norms of intellectual property to ensure access to the poorest. We need an environment that will foster research for neglected patients and disease. We need to be, as some of my colleagues have said, we need a production and distribution of health products accessible to everybody. So, and this can only happen if somehow we could clone some sort of initiative like DNDi. We can call it some little pharma initiative, but it needs to be in the same spirit of being non-profit, financed by public funds, being at low cost like the model of DNDi, and create treatment that is acceptable to the patient. And so this can only be done in a cooperative mindset. And of course, I am glad and proud that MSF has voted his commitment to DNDi for the next 5 years, and we hope that other endeavors will happen as well. Thank you very much.
Thank you. Thank you very much. Thank you, Joanne, and thank you also to bring us back to the notion that the neglect is not only in a subset of diseases, but in it's a matter of neglected patients, and increasingly, as we also heard this morning, those are everywhere, because we see a sort of globalization of poverty taking place today that is really shifting the picture and the paradigms that we have been working with so far.